Timing of antiretroviral therapy after diagnosis of cryptococcal meningitis. Definition: antiretroviral therapy is the treatment that suppresses or stops a retrovirus. It is the combination of several antiretroviral medicines used to slow the rate at which HIV makes copies of itself in the body.
Cryptococcosis is a disease caused by the fungus Cryptococcus. Cryptococcus is a type of fungus that is found in the soil, usually in association with bird droppings. The major species of Cryptococcus that cause illness in humans is Cryptococcus neoformans, which is found worldwide. Another less common species that can cause disease in humans is Cryptococcus gatti. Since 1999, Cryptococcus gatti has also been found in regions of the Pacific Northwest, particularly in Vancouver Island in British Columbia, and Oregon and Washington in the United States. Cryptococcus neoformans typically infects immunocompromised persons. Most people in the United States who develop this infection are HIV infected or have other conditions affecting their immune system. However, occasionally persons with no apparent immune system problems develop cryptococcosis. A wide range of animals can also develop Cryptococcus neoformans cryptococcosis. The spores from Cryptococcus neoformans live in bird droppings, especially pigeon droppings, and in soil contaminated with bird droppings. Humans can get cryptococcal infection by the inhalation of airborne fungi, which are spread from these sources. Cryptococcosis is not known to be spread from person to person, animal to animal, or from animals to humans. Infection may cause a pneumonia-like illness with shortness of breath, coughing, and fever. Skin lesions may also occur. Another common form of cryptococcosis is central nervous system infection. Symptoms may include fever, headache, or a change in mental status. To prevent Cryptococcus neoformans infections, people who have weakened immune systems should avoid areas contaminated by bird droppings and should avoid contact with birds. Infections with Cryptococcus gatti have occurred in both healthy persons without compromised immune systems and in persons with conditions affecting their immune system. A wide range of animals can also develop cryptococcosis from exposure to Cryptococcus gatti. Its spores appear to live in association with certain trees and the soil around trees. Humans can become infected by the inhalation of airborne fungi, which are spread from these sources. These are just a few things to know about Cryptococcus fungi. To learn more, please visit the website shown on the screen.
Antiretroviral therapy is a lifelong commitment. Because HIV infection is a permanent state of war. But how can we improve adherence? And limit collateral damage? What is the best first-line regimen? How do different strategies compare? When do we need to switch to other approaches? Are new molecules still necessary? Despite more than 25 antiretroviral drugs and tons of clinical trials and guidelines, antiretroviral therapy remains an individual choice. Come to discuss it. www.isheed.com.
Applications in medicine. The antiretroviral therapy should be initiated after the diagnosis of cryptococcal meningitis. It involves the balancing of the survival benefits conferred by the antiretroviral therapy against the risk of immune reconstitution inflammatory syndrome. Antiretroviral therapy is used to reduce the amount of virus in the body to a level that can no longer be detected with current blood tests.
HIV is treated with a combination of medicines called antiretroviral drugs or antiretrovirals. This is combination HIV therapy when you combine drugs from one type of antiretroviral with another type of antiretroviral. This is also known as highly active antiretroviral therapy, which basically means you're taking 3 drugs, usually from 2 different types of HIV medicines. This combination is stronger or more potent and is able to control HIV infection to the point where virus levels in the blood become undetectable by current lab tests. So combination therapy is really the best way to treat and control your HIV by using at least 3 medicines, preferably from 2 different classes or types of antiretrovirals in order to control your HIV. When a doctor is determining what kind of a combination antiretroviral therapy regimen to choose for a patient, they usually look at international guidelines and other kinds of research to determine what are the best regimens to control HIV infection. So right now, for adults, the best regimen is considered a combination of 3 drugs. One of them is called tenofovir, another is called lamivudine, and another is called efavirenz. So in most settings, this is the combination that will be used. Sometimes people replace lamivudine, also known as 3-TC, with another drug called FTC. So the combination of tenofovir plus 3-TC or FTC plus efavirenz can be taken once a day. So not only is this a very good way to control your HIV because the combination of medicines is quite strong, but it's also easier to take because you only have to take a pill once a day instead of twice a day. But in many settings, this combination of drugs may not be available because it's a little more expensive than other types of medicines. So consequently, another type of regimen would include something called zidovudine or AZT, lamivudine or 3-TC, and either nevirapine or efavirenz. The AZT and 3-TC need to be taken twice a day, and so does nevirapine. So people who are on this regimen need to take their medicine in the morning and in the evening in order to control their HIV infection. So to summarize, you can either be on a twice-a-day medicine such as AZT, 3-TC, and nevirapine, or you can be on a once-a-day medicine like tenofovir, 3-TC or FTC, and efavirenz. Either way, these medicine combinations are strong enough to control your HIV infection. In cases where the medicines are not strong enough, this is usually because the HIV virus in your blood is resistant or not responding to one of the medicines inside of that combination. That's known as HIV drug resistance. When you have resistance to those medicines, the medicines stop working and you develop something called treatment failure. In those situations, patients will need to take a stronger medicine from a different class of antiretroviral in order to control their HIV infection. Anybody who's worried that their HIV medicines are not working to control their infection should speak with their doctor about how to diagnose that. It's usually done through a viral load test, but this can be discussed in more detail with your doctor.
PROS, the preservation and restoration of immune function, improvement of overall health and the prolongation of life, the suppression of viral replication. Cons. Iris may be fatal when it occurs in the brain. Earlier, antiretroviral therapy is more harmful in high-risk patients with a predisposition to cryptococcal iris.
The World Health Organization has made key recommendations regarding antiretroviral therapy. Any HIV patient with a CD4 count of less than 350 cells should begin antiretroviral therapy. It is important to clarify that antiretroviral therapy is not a cure. Additionally, adhering to an ART treatment regimen on a consistent basis is difficult for many people to manage. The medications have multiple side effects. Additionally, between the ART medications and other medications used to treat opportunistic infections, an HIV-infected person might be taking as many as 40 pills each day. Some of these medications must be taken with meals. Some medications must be taken on an empty stomach, while others must be taken 2 hours after a meal. The scheduling alone can make it difficult for some people to adhere to the treatment regimen. A major concern with ART is the potential for developing drug resistance. Newer antiretroviral medications do offer some improvement against drug-resistant HIV.
Antiretroviral therapy applied in Ecuador. The antiretroviral coverage in Ecuador from 2000 to 2004 was 26, and from 2010 to 2014 was 31. That is the percentage of all the people living with HIV who are receiving antiretroviral therapy.
We have more than 30 antiretroviral drugs. And drug resistance can be thwarted in most cases. But therapy must be adapted to comorbidities. It needs everyday doses and has to be available to those who cannot afford it. Major advances have been accomplished, but a long road is still ahead. As treating every patient on Earth is the only way to shut down the pandemic. Come to discuss.
Conclusion: deferring antiretroviral therapy until 5 weeks after the start of amphotericin therapy improves survival rates among patients with cryptococcal meningitis as compared with initiating antiretroviral therapy at 1 to 2 weeks.